Admitting.
Hi, everyone. Thank you so much for joining us. As everyone gets settled in, if everyone could please mute their lines. All right, I think we can go ahead and get started. So welcome everyone to session 2 for our CalAIM's Collaborative Planning and Implementation Group for the Northeast Region counties. We'd like to let everyone know that this session is being recorded. And next slide, please. Next slide. Next one. Thank you. This session is being presented by our partners. My name is Melissa Meza, and I'll be one of your facilitators today alongside our partners at Everyday Impact Consulting. I'm a senior program manager at Health Begins, and at Health Begins, we are a mission-driven consulting and training firm, and it's our goal to help healthcare and community partners improve the social and structural drivers of health equity for patients and communities. Our role for this collaborative is to present to you guys the Northeast Region Collaborative. And so this is presented by our partners at the Department of Healthcare Services with support from the Public Consulting Group. Next slide. Before we get started, I'd like to kick off some things with some housekeeping items that will provide a great foundation for today's session. First, we'd like to invite you to update your Zoom name to include your name and the name of your organization, as well as your pronouns, if you would like to include those, so we can get to know one another. Second, to learn more about your needs and interests for today, please let us know what you are hoping to learn from today's session. Please go ahead and use the chat to drop in what you're hoping to learn for this session. This will support us in better tailoring the conversation to meet your needs. And then finally, which is the most important, we want to strongly encourage you to engage. This space has been designed specifically for you so that we can work together to make CalAIM a success. So in addition to posing questions towards the facilitators, please peer network, engage with one another, and uplift your experiences and needs throughout the session, as well as through using the chat. Next slide, please. Before we get into our agenda and the meat of today's session, we have a few assumptions about who is here today. And so if you are here today, we are assuming that you represent a California-based organization that is located in or provides services in the following counties, which include Shasta, Trinity, Lassen, Modoc, or Siskiyou counties. In addition, your organization is interested in or is currently providing CalAIM services pertaining to enhanced care management or community supports. Third, you have registered to participate in the CPI collaborative. If you have not registered, the following slide will give you a breakdown on how to register. But before we move to that, you are committed to improving the lives of Medi-Cal beneficiaries and collaborating with colleagues to achieve the goals of CalAIM. Next slide, please. As I mentioned, if you are here, it is likely that you have already signed up for the Collaborative Planning and Implementation Group. However, if you have not already done so, we want to take this opportunity to just quickly walk you through the process of registering for the collaborative, as well as making sure that you're accounted for as a participant in the Northeast Collaborative. The first step is to visit the PATH Collaborative website. We will be dropping the link in the chat. So if you want to take a few minutes to go ahead and access that link, you'll register to participate by navigating to the link that is to the button that is shown here in red. And then step 2 is to register to participate. Through that process, you will be asked to select an organizational authorized representative to submit a form on behalf of your organization. You can register for yourself as well, so you don't need to be an authorized representative. In addition, we'll gather your organizational contact information, and then you'll provide a short narrative response on the types of organizations, counties you serve, etc. Finally, when you get to the end of that form, you will be agreeing to be assigned to a collaborative planning group. One short thing to note is that if you do want to be part of the Northeast Collaborative, you should have selected being a part of either Shasta, Trinity, Siskiyou, Modoc, or Lassen counties. And then once you've completed step 1 and step 2, our Health Begins team will receive notice that you have been assigned to our collaborative, which is the Northeast Collaborative. Once you've registered through the CPI PATH Collaborative registration page, we will be sent that notice and you will be sent a Zoom registration link for the monthly sessions that we are hosting. Just an FYI, our meeting links will be sent by our project coordinator, Eva at healthbegins.org. Next slide, please. Before we move forward, I'd like to cover our objectives for the day. That being said, we have 4 objectives for today's session. By the end of today's meeting, participants will 1, review and react to the draft project charters and aim statements intended to guide the Northeast Collaborative. 2, we will establish objectives from the draft goals to guide our facilitation over the next year. Number 3, we will continue engaging in relationship building and understand the most current successes and initiatives in Northeast counties. And finally, we'll inform the measures that we'll use to track our progress over the next year. Next slide. In order to accomplish this, we've broken down today's agenda into 4 parts. The first part will be our welcome. This includes level setting, going over our registration process, doing a quick round of introductions, and then providing you with a CPI recap. Second, we will do a session recap. So if you weren't here for session 1, we're going to lightly touch on some of the things that we heard, which includes setting our group norms, outlining what we heard from you, as well as providing you with the opportunity for any Q&A. And then part 3 includes developing shared goals. This session is building off of our session 1. Again, if you missed that session, we are going to be reiterating some of that stuff. And so we'll do 2 activities here. This is going to be the bulk of today's time. And then we'll close out with a Q&A. To close out this session, we have our next steps. So we'll give you an idea of what's to come. We'll also share some immediate resources and a special thanks to all of our facilitators and participants. And if you are just joining us, a copy of today's deck will be provided in the chat, and you can click on any component of the agenda to access any specific information you are looking for. Thank you. So I'm going to quickly check the chat and just see what we heard from all of you in terms of what you are looking to learn. Okay. So before we begin, we wanted to quickly go through why CalAIM work matters to us. And so with that being said, we'd like to launch today's session with some introductions, particularly around our facilitators. And so we'll start with our wonderful facilitators, Maiku, Vince, Casey Ann. Would you mind letting us know why CalAIM work matters to you? And then we can go ahead and just unmute ourselves.
Thank you, Melissa, for providing that overview of today's session. And welcome, everyone. It's great to see you all here. I think I see some new faces, but also some returning faces from our January session last month. So welcome to everybody here. My name is Maiku Tao, and I serve as our Director of Movement Building Initiatives at Everyday Impact Consulting. And I'm joined here by my colleagues, Vince and Casey Ann. But really wanted to also talk about why this CalAIM work matters to me. I actually grew up, in Northern California, come from a low-income, first-generation Hmong American background, and so I grew up on utilizing these kind of resources. I was a Medi-Cal beneficiary myself growing up, and all the way through college, and so just really wanting to give back to folks and ensure that access and quality of just these health services for our communities goes back to exactly answering those needs. And so that's a little bit about me. I'm hoping to get to know a lot of you over the course of the session, but I'll go ahead and hand it to Vince as well to share.
Hello, everyone. Thank you, Maiku and Melissa. I'm Vince Salas with Everyday Impact Consulting. Why CalAIM is important to me is because my mom is on Medi-Cal. She's a member. She's been a member for the past 2 years. She's end-stage kidney survivor and goes through dialysis every Monday, Wednesday, Friday. So Medi-Cal is very important to me and my family. Also, many years ago in the 80s, my grandfather was a farm worker in rural Central Valley. So health benefits and ensuring those are available to migrant workers is also very important to me. In a previous work, I also participated in the State Office of AIDS Multicultural Liaison Board, where we did listening sessions in different parts of the state, including Northeast, to find out what are the needs are in communities around AIDS prevention and services. I'll turn it over to KCN.
Thank you, Vince. Hi, everyone. My name is KCN Carbonell, she, her pronouns. I'm also a consultant with the Everyday Impact Consulting team. CalAIM is important to me. I also have a parent. My dad is on Medi-Cal and also justice involved. And so seeing the priority populations under CalAIM would really support and help just people who are close to me and near and dear to my heart and communities that I work with. I grew up in Stockton in the Central Valley, one of the worst air quality zip codes in the state. And so also seeing asthma mitigation being a service under CalAIM, again, would really benefit supports for communities that I grew up with, organized with, and hold near and dear to my heart. So that is why CalAIM is important to me.
Thank you so much for sharing. And if we can move to the next slide. One more. Thank you. And so in order to really get to know one another, I want to thank Maiku, KCN, and Vince for having shared their experiences. I also wanted to quickly touch on why CalAIM work matters to me. I also, like a lot of our colleagues here, grew up using Medi-Cal services and have witnessed a lot of the inequities that have been presented with Medi-Cal services early on. And so my goal for this work, as well as engaging in CalAIM, is just making sure that it's being advanced and that it's touching the communities, those that I used to live within. So just wanted to quickly touch on that. And then in order to get us moving forward, we wanted to call on 3 new participants. So I know we heard from a few of you during our first session. For these introductions, we'll call on 3 new participants to give a brief introduction as to why CalAIM work matters to them. So I'm just going to go through our list and see if we can pick out some new people. Let's see, Kara Dwyer.
Hi, my name is Kara. I am a housing specialist with home and healthcare management. I am relatively new to the position, but CalAIM is important to me because it houses a very niche population that deserves services.
Thank you, Kara. And then let's go with Trisha.
Hello, Trisha Aberg with the Human Response Network. We are located in Trinity County, and we're one of the few nonprofits we have here. So just wanted to be able to join the collaborative because of that. We'll be doing the housing supports here. And so we're working with partnership on developing our programs for that. I do apologize. I have a conflicting meeting that starts at 2, so I'm going to have to hop off soon, but I wanted to join for a bit while I could. Thank you.
Yeah, thank you so much for joining us. And if there are any of you who have to hop off this session, will be recorded, and then we'll also be sharing the materials. Thank you, Trisha. And then we will go with one last person. Let's see, Donald. Okay, so it looks like Donald may not be. I see a hand raised. Carolyn?
Yes, thank you so much. I may have to hop off too. We are going into storm alert for emergency services, but I wanted to make sure I introduced myself. I represent the Disability Action Center, and we are also working with CalAIM, providing nursing home, nursing facility transition, as well as homelessness diversion through CalAIM. And we also have a program for youth and young adults ages 14 through 30 that we want to let everyone know about, which provides free vocational training and services for our young adults transitioning out into the community. So I'm very excited to be here. We've been wanting to get more connected with everyone who's actually here on this line.
Thank you so much. And then I think, is there anyone else who wants to do a quick introduction? Okay, I think we can go to the next slide then. I see Jennifer unmuted. Jennifer, did you want to do a quick introduction?
Hi, Melissa. I'll introduce myself. My name is Laura Acosta, and I am the Community Health Director for the 3 Dignity Health hospitals in the North State.
Hello, Laura. Nice to see you again. Thank
Likewise.
you for joining us. All right. Thank you so much, everyone, for having provided your introductions. We are really happy that you're here, and thank you for joining us. Before we dive into the content, we quickly wanted to touch on some of the CalAIM initiatives and give everyone just a quick brief overview of CPI. So we understand that CalAIM is incredibly multifaceted, and this group especially is comprised of a mix of expert, novice, and beginner CalAIM providers. So before we dive into our session content, we want to start by explaining how CPI fits into CalAIM. This includes just clarifying some of our roles and providing you with more context as to the role of CPI and CalAIM. With CalAIM, California Advancing and Innovating Medi-Cal is a long-term commitment to transform Medi-Cal by offering a more equitable, coordinated, and person-centered approach to improving population health. This transformation includes an expansion of services that brings new providers into the Medi-Cal landscape, including some of you that are on the line today. There are many ways for providers to participate in CalAIM, and our time together will focus on enhanced care management and community supports providers. CPI is a space for CalAIM stakeholders such as community-based organizations, managed care plans, tribal health programs, county agencies, and many others to network, uplift CalAIM challenges, and identify solutions to contracting and implementation in a supportive space. Your seat in this initiative is fully funded by the PATH program. And then just to close out PATH, PATH is aiming to achieve the goals of CalAIM. DHCS is funding the Providing Access and Transforming Health initiative. This is a 5-year funding plan to support stakeholders like you in successfully participating in CalAIM. PATH does have 4 programs, and CPI is one of those 4 programs. Next slide, please. And then we just wanted to touch on the role of the facilitators, including your role, just give you an understanding of who is administering this project. And so just starting off at the bottom, the Department of Healthcare Services is the state agency that is funding these health services. We have a number of CalAIM PATH programs. As I mentioned, there are currently 4. And so this is a funding initiative to increase CalAIM capacity. The Public Consulting Group is actually helping administer CalAIM PATH programs. So you might hear of them. If you signed up for this collaborative planning and implementation group, you navigated through their page. And then that's where the facilitators come in. So we have been selected, Health Begins and Everyday Impact Consulting specifically, to support CalAIM stakeholders in the Northeast in identifying challenges pertaining to CalAIM. We've also been selected as facilitators to support peer-to-peer development, strategize, troubleshoot barriers and any challenges you're experiencing, as well as providing a space for you to network with other providers in the counties that are throughout the Northeast, which include Shasta, Trinity, Siskiyou, Modoc, and Lassen. And then your role here as CalAIM stakeholders or providers, tribal programs, direct service providers, managed care plans, is to engage and learn from others as well as network. And finally, the major goal here is that you will support in improving outcomes for Medi-Cal beneficiaries and communities. Next slide, please. And of course, this is a collaborative effort. And so in order for us to accomplish these goals and for us to meet our role as facilitators, we will be hosting monthly sessions. This collaborative will meet on a monthly timeline to issue spot and work plan. These sessions will be held virtually and in person. Regarding the in-person, we will be sending out communications to gauge your availability. Again, like I said, we'll jointly develop guiding principles and aim statement, project charters, and more to ensure we're leading the collaborative as participants have designed and requested. And then finally, we will collaborate. And so that means uplifting your CalAIM experience will be our key to our shared success. Participants are expected to collaborate with one another, share best practices, present their challenges, provide feedback, and complete service. So that ends my portion of today's session. If we can go to the next slide, I will go ahead and hand it off to our co-facilitator, Maiku.
Perfect. Thank you so much, Melissa, for just getting us grounded and in the space together. And so I'm really excited to take us through just a session one recap. As I mentioned, there are a few of you who were there for our January, and then so beautiful to see so many new faces joining us in today's session as well. And so if we could move to the next slide, during session one, we covered the following. Number one, the goals and background of the CPI initiative. We shared our norms and agreements for participating within this group. Number three, we talked a little bit about what success will look like, but want to dig into some of those conversations with you all more later in the session. And then lastly, the initial makings of an aim statement and project charter. And so those were just some of the key topics that we discussed in session one. And if we can go to the next slide, we wanted to reflect back with you all here in this space just about what we learned. And so following our January session, both our Health Begins and Everyday Impact Consulting team took a number of one-on-one meetings and sessions to meet with partners outside of this monthly session. And so what you're seeing on this slide is just what we heard from a number of partners in one-on-one meetings and determined just a really brief overview and broad gap analysis that we heard both in the session as well as the one-on-one meetings. And so just looking at the one-on-one meetings, some of the items that we heard and topics is that providers are experiencing reimbursement issues, want to have a better understanding of regional best practices. There's a lack of supply issues, streamlining referrals, both with the managed care plan and DHCS processes. There's a health information exchange, data integration and contracting that came up as a challenge and barriers there. Wanted to also highlight the least used community supports and enhanced care management services, and then also expanding the ECM and the community support service directory. So that's just a recap of some of the conversations that we had following January's session last month. And then in terms of a gaps analysis broadly across the Northeast counties, there's been an identification of a lack of workforce development for primary care and WIC providers. There's a lack of ECM and CS cohesive partner coordination across the Northeast counties represented here. And then there's a need for more peer-to-peer learning and support across ECM and CS providers in the Northeast counties. And so, that is what we had captured just as our follow-ups from the January session itself. And so if we can go to the next slide as well. Following the session, there's a beautiful quote that we pulled here. We need to leverage existing networks by working with existing collaboratives. And so I know I saw Doreen on here, and thank you so much, Doreen, for just, taking a meeting with our team. And we hope to have some more one-on-ones with other folks on this call as well. But wanted to just lift up some of the collaboratives that we heard and ensuring that we are not duplicating efforts in this space, but that we're utilizing this space to be that peer-to-peer networking and opportunity for folks to share and best practices and learnings among one another. And so hoping to cultivate a space like that. And so I wanted to just sum up what has taken place since the January session. And if we could go to the next slide, I just wanted to review our group norms that we had. If you all recall who were there, we did a quick exercise just to really set the space for this CPI initiative in the Northeast. And so some of what we heard loud and clear about how we want to cultivate the community norms and group norms in this space is, number one, that there's multi-sector collaboration, figuring out how there's room for all of us at the table, regardless of your entity type, and working collaboratively, not competitively. Want to ensure there's advance notice for meetings as much as possible in order to be prepared for meetings. There's an ask to be specific with goals and objectives for these monthly meetings. Want to uplift the understanding and experiences of rural communities. And then lastly, wanting to determine what each entity wants to do or work on as a part of your engagement with this initiative. And so to sum up this section here, if we can go to the next slide. So just some of the key takeaways from parts 1 that Melissa covered and part 2 that I've just covered here. Really these CPI meetings will be built upon the lessons learned from prior initiatives such as CalAIM links and CalAIM roundtables. Again, just reiterating that this initiative is not a duplication of DHCS CalAIM efforts. Number 2, we want to cultivate a space that is meant for peer-to-peer dialogue, discussion, and learning and sharing of best practices across the Northeast counties that we are engaging in for this project. And then lastly, and most important, we want to hear from you all. And so I'm going to pause here. And if we can go to the next slide, see if folks have any questions about anything that I've just covered. And feel free to mute and unmute as well, or drop any questions into the chat, but want to just open up and see if there are any questions. Okay, not seeing any. I'm going to keep us moving along because we want to hear from you all, as I mentioned. So if we can go to part 3 of our time together. Feel free to drop any questions again in the chat or mute and unmute. We really want this to be a dialogue space. This is your space. And so, feel free to let us know how we can best support you in that. And so just wanted to do a preview of what we mean by developing shared goals. If we could go to the next slide here. Over the course of the next several months and sessions, we'll be developing a number of shared goals, as Melissa had mentioned. So in session 1, we covered just briefly an aim statement and a project charter. And so what you're seeing here is a progression of the other topic areas and project charters that we want to established by the end of March. And so wanted to share with you all that there's an intention to create an aim statement of what are we trying to accomplish. There's an intention to have a driver diagram developed. And so what's driving that change? What is the change package? And so that's key content, especially learning from you all what that change needs to be, and then measuring what that change looks like and what success looks like. And so these are just some of the other topics and a progression of what we will cover in our upcoming sessions to get to a place of establishing these important documents for this initiative. And so if we go to the next slide, wanted to just then get us going into our breakout rooms and activities for the day. One thing that we heard loud and clear from session 1 is that we want folks to be able to talk across counties with one another. And we have, again, the 5 counties represented here on this call. And so for activity 1, we want to hear from you all. And Melissa will go ahead and help to break us out into 2 breakout rooms, but essentially, In your discussions, we'll first off do a quick just introduction, right, of folks so that everybody gets familiar with one another in the space. But lastly, we want to hear from you all. And so if you can see here on this slide, we are asking folks to share 1 to 2 relevant initiatives happening within your local county or counties. If you cover multiple counties, highlight any successes that you may have seen. And then what sort of potential solutions can you think of for how the space will be beneficial for you? And what we mean by the space is really the CPI initiative space. So how can we be most beneficial to you within this space as well? And so I'll pause there and see if we have anybody has any questions. Otherwise, we can get ready to break folks out. Okay, not seeing any. I'm going to go ahead and just check in, Melissa. Are we ready for the breakout rooms?
Yeah, I am setting those up right now. So they are going to be opened.
Perfect. Okay, well, so we will be in our breakout rooms for about 15 minutes, and then we'll come back and do a report out. If folks could also assign just somebody who could share, do a share out at the end when we come back together, but we'll see you in a little bit. Hi, welcome back, everyone. Welcome back, welcome back. That time just flies when we're having great conversations. I don't know about you all, but it feels like that.
You know, I did find while we were talking, the article was actually, or an article was written up in the New York Times about the Houston initiative. They moved 25,000 people from the streets into homes of their own. So if anyone wants to look it up, yeah, it's from June 14 last year, and updated earlier this month.
Yeah, Anita, I think that that's really important what you're flagging, because as a part of the collaborative process, I think success modeling is going to be so important, figuring out what worked, for other initiatives, and trying to pick out which processes we might be able to adopt, based on the CS that's being provided. And obviously, like what we're realizing is that most providers are, providing services pertaining to the housing trifecta. So, housing, navigation, deposits, tenancy services. And so, yeah, we would love just any information to get forwarded to us, just for us to dissect and just review for sure.
Sure. Happy to.
Hi, everyone. Eva, if we can just take the slides down for now so we can all see each other. Welcome back. Apologies. Some of us got kicked out and our conversations got cut off. I'm not sure. I couldn't stop the breakout rooms, and so we just all got kicked out. I just want to apologize in advance there. But yeah, I'll hand it over to Vince and Maiku to take over for this piece.
Perfect. Thank you all so much. And I was just sharing as everybody was coming back into this space, that is not enough time. Like, we are just, when we're having such good conversations, it's just the time flies. And so just appreciate everyone's patience, and totally understandable, Melissa. We're in this virtual Zoom world, and technology is reliable, but not all the time. And so totally understand there. But for this next piece here, we really want to do a share out and a report out. And so I'm looking to Vince to see if we had somebody who was designated also to share out. Anita's going to share out from our breakout room, but Vince, why don't we start with breakout room B, and then we can end with breakout room A.
Thank you, Maiku. So for our share out, I'm going to ask Melissa to do an overall, but we want to make sure we have time for Shasta counties. I'm going to ask Kara, and I'm not seeing the name off the top of my screen. Oh, and Natalie, to provide an update on Shasta, because we weren't able to get to them. So Melissa, floor is yours.
Yeah, thank you. So just touching base on some of the things we heard as in terms of relevant initiatives that are occurring. So Shark, Doreen is part of that group. They are providing a lot of technical assistance. They initially had a committee that has morphed into addressing more CalAIM initiatives by providing education around billing issues. They've identified some case management issues and are working to provide more technical experience and technical assistance in that area. And then they're also working closely with Partnership Health Plan to provide education around ECM and hosting a lot of trainings within the counties that they are providing services through. With some of our other groups, we did hear some of the barriers. And so with the CSS populations, there are some issues with implementing ECM and ensuring that the counties who are providing the assistance are actually representative. And so, for example, with this particular area, some of these CSS populations are receiving calls from LA County. And again, LA County doesn't know what's going on within these rural areas. So just bridging the gap there and ensuring that the individuals who are contacting them are aware of the barriers and challenges that they're experiencing to accessing services. T shared for us as well. He's also working with Danielle from Partnership to understand ECM and CS services, and also working with Danielle to identify how they might work within Modoc County to advance some of their initiatives there. But in general, there are some bandwidth shortages coming out of the pandemic. Time and resources to understand and engage can be a challenge and barrier for a lot of these communities who are just now implementing ECM and CS services. Workforce, we've heard it during this session and in the past session, is also an issue. There's a lack of infrastructure within the Northeast. And again, we've heard this too, we're not clear whether these initiatives are sustainable. So just wanted to touch on some of those things. And we heard a ton of other barriers, so I'll hand it off to the other members in case they want to share too.
Yeah, I'd like to make sure that we have time for Kara and Natalie to talk about what they're seeing in Shasta. Kara, go ahead and unmute.
From my standpoint, I'm kind of the newest member of the team here, and we're still in the implementation phase. We have some things that have yet to be approved in order for us to actually begin providing services. So I personally don't feel as if I have a lot to contribute here, but Natalie may have more to offer. She's my team member as supervisor.
Thank you, Natalie. Go ahead.
So we've been developing ECM here in Shasta County for over a year now, and we still have not been able to provide services. We're struggling with getting our collective medical agreement, and there seem to be more and more requirements for health information exchanges, and that puts a lot of our clients' information at risk. And that's riskier for the county to take on as well. So that's definitely a barrier. And it's the reason why we're not yet providing services. Reimbursement rates, as have been stated many times, are a huge barrier. They're based on community health workers when we're supposed to be serving I think it's the top 5% of people who need the most help. It doesn't make sense. And so we couldn't hire a community health worker because it would be asking a lot based on what the criteria is for a community health worker. That's a huge barrier. The intensive reporting paperwork needed in order to get anyone signed up. I mean, there's so many barriers just to get people into our services. Another barrier, I've been working closely with partnership and they've been super helpful. But we're over in my department, we're very used to the specialty mental health population, and I think some of the paperwork and all of the administrative stuff is going to be barrier getting our people, the people that we're trying to help and to serve, getting them connected to services they need. Additionally, we have a lot of resources. It's not enough, but trying to figure out how not to duplicate services based on the framework we've been given for ECM is another barrier. So we've had to figure out some sort of plan to prevent that from happening. So there's been a lot, but those are the things that initially come to mind.
Can I respond or ask Natalie a question, if that's okay?
Yes,
Natalie,
please.
Natalie and T probably could help. Natalie, I don't know if you know, but the county, I believe, signed an agreement to participate in the health information exchange. It was negotiated for years. So I don't know if you know that. So just throwing that out there.
Are you talking about Sac Valley Medicare?
Yeah.
Right now, we're trying to contract with Collective Medical though as well.
That's partnership. That's a partnership and the requirement for. Let's talk offline. And T may have some, insight.
Okay.
Yeah, I would encourage you, Natalie, to we should talk, because Collective Medical, depending on which module you're talking about, is built into Sac Valley, so you may already have that connection. I would encourage you to talk to John Helvey, the executive director. But yeah, and FYI, Sac Valley has a lot of the counties. In fact, I'd have to check, but I think all 5 of these counties in this group have signed on to Sac Valley. All of the hospitals have, many of the clinics have, labs. The missing link is the CBOs. That's the missing link. And as I said on the meeting last time, that there is a plan in place to do that. It needs some funding, and that would be a wonderful outcome of this work if we can figure that out.
So I just want to briefly flag, Vince, before we head back into the AIM statement rooms, that we were so appreciative of exactly that being uplifted. So we would really like to continue that conversation. I don't think it has to be offline. Like, this is the space where we could absolutely like uplift that specific information. And it's so great that it's going to tie into the AIM statement conversation and the chartering conversation, because that was one of the aims, was determining how to create or establish a smoother pathway for those smaller providers to participate in an HIE. So I'm just so thankful that that was uplifted, so that way we can continue that dialogue in the next breakout.
Thank
You know,
you.
my full disclosure, it's a nonprofit, Sac Valley MedShare. I'm on the board. So full disclosure there, I don't know why I feel compelled to say that, but I do. The only thing I would say is we can do that, but I just caution you. I'm one of the few people on the board that, you know, doesn't own a pocket protector, and it gets real complicated and very nuanced very quickly. So just kind of a word of caution. The data stuff is it's a black hole. It's complicated, and it's very nuanced. And yeah, so I'm not sure how far we'll get, I guess, but I'll stop there.
And I'll just add a couple of things. We did a study on a community connected network, and all these systems that are in place already, be it Sac Valley MedShare, Collective Medical, HMIS, all of it. And then the states moved to a statewide health and human information exchange. It's supposed to go live 2024. So that's another discussion, and it's very complicated.
Yeah. Well, thank you, T. Did you want to say anything else, T? You unmuted.
No, I think I'm good. I'm good. Thank you.
Thank you. And so appreciate the conversation that's taking place here. Exactly. The exchange and the peer-to-peer conversation is really meaningful, and hopefully we can continue the conversation and benefit from each other's experiences and expertise. Appreciate that. And if there's nothing else, I would like to punt it back to Maiku for the other group.
Thanks, Vince, and thanks everybody for sharing. I'm actually going to call up Anita, who's going to do just a quick summary of what we had discussed as well in our group, and then a tap on Alexis for any kind of other insights before we move to our last conversation of the day. So Anita?
All right, so we briefly talked about homelessness initiatives that I was just mentioning that I haven't seen that much success in Shasta County. I'd seen a bit more in Butte County, but hadn't been, or at least have not been updated on any kind of successful initiatives in Shasta County lately. I did share that I'm from Houston, so I have just recent knowledge of their success stories about recently rehousing about 25,000 homeless people, and was sharing with the group that there's a write-up in the New York Times about whatever they did. So it might be worthwhile looking into to see if, I know it's only the 4th largest city in the US, but if they have any kind of winning strategies or anything that we can take away from whatever they found successful there, then that would be good. And then Donald spoke about the challenges, I believe, some of the possibly reporting and billing challenges, even though they're still in the process of setting up their ECM program. And I did want to touch on that too. I didn't so much in our breakout session, but we are having challenges with the volume of information that the insurance plans are requesting us to get. And so if anyone has any kind of expertise or best practice in getting those RFTs and all of those in a timely manner, whatever process of uploading or downloading, or I don't know, but whatever kind of successful method anyone has, we are happy to hear about it and see if it, we can implement anything successful with our current methodology for reporting.
Great job. Thank you so much, Anita. Alexis, any other insights that you might want to share from the conversation?
Yeah, I following up on what Anita was referencing, I think that success modeling is something that is going to be incredibly important for this collaborative. That goes back to session 1 as well. as we uplifted during the first session, this first quarter is really going to be like our work planning phase, identifying what those issues are, so that way we can reverse engineer like what our action items are to like move the collaborative towards that collective success. So success modeling is going to be something that's so important, figuring out what other counties did that we can mimic and fit to like the specific needs of these counties. We also uplifted that there are some gaps in information sharing. So just trying to figure out what the conduits are to being able to share information across providers, across CalAIM stakeholders. We also discussed that we're seeing more providers moved beyond contracting to implementation, which is very exciting, considering that in November of 2021, providers were frantic, and CalAIM stakeholders were frantic, just trying to figure out, what is CalAIM? How do we do this? How do we transition from prior programs? So that's also really exciting to see. But even though we're saying that we're experiencing that movement, it's still very important to uplift that providers are still experiencing issues with the contracting process, and that it's complex. I think it's very fair to say that we appreciate that the plans are present and trying to provide a litany of support, but just still being very honest about how complex that process is, and just making sure that we're identifying what specific learning gaps are also being uplifted within that contracting process as well.
Great. Thank you so much, Alexis and Anita, for just sharing the conversations and discussion in our breakout rooms. I'm going to go ahead and move us to our next activity, just to give folks enough time to go ahead and have discussion as well about the project charter and aim statement. So if we could bring up the slides again, I'm just going to frame us up for the next conversation that you will have in the next breakout room. So again, as we mentioned today, really wanting to solidify a project charter as well as an aim statement for the CPI initiative in the Northeast counties. And so again, just a reminder that project charter is a document that states what we are setting out to achieve, how we will measure success, and the timeline in which we want to achieve that success. And then the aim statement is specifically a specific expression of what we will have accomplished by the end of the collaborative. So if we can go to the next slide. Since the first session and what we've heard, our teams have went ahead and developed some draft aim statements. And I'm just going to move us through quickly with some of these draft documents, because we will also be sharing these documents with you all to have further feedback and input provided by you all, but wanted to share the two draft aim statements that you see here. At the top, to improve care coordination and data sharing, we will work to increase the participation of small providers and health information exchanges in Northeast California by December 31st, 2023. And then the second bullet here is to promote sustainability. We will work to leverage referrals capacity and reimbursement rates among providers to sustain programming by December 31st, 2023. So again, I read through that pretty fast, but we're going to talk a little bit about it in our next session here too. If we could move to the next slide. And then just go. So this is just a quick reflection of how we built the aim statements as well, what, who, when, where, and by how much of impact we want to improve upon. The next slide will show you just all of the questions that are a part of this project charter that we need to also complete and establish as a CPI initiative altogether. And then if you could just go to the next two slides as well. Our team went ahead and developed just some draft project charter language from what we heard from you all. But again, we will share this out with you all following this meeting for additional input and feedback. What you'll see on the left-hand side is what the project charter component is, the drafted language that our teams developed, and then where's the source from that content. So we are pulling it from session 1. If we go to the next slide, we have a project charter continued. And so for today's discussion, we really want to focus on what some of those deliverables and objectives are, and also start to talk about, we've been talking about it, but continuing to elaborate on any kind of constraints, assumptions, dependencies, and risks. And then lastly, something that we want to touch upon, as well as any kind of measurements of success for the project charter. And all of that will be sourced from our conversations in session 2 and 3. So let's go to the next slide just to set us up for that conversation. Sorry, Melissa, do you have
I have
question? Yeah.
breakout rooms ready, but I'm just wondering how much time you want
Got
to
it.
do those for.
Yeah, I think we're still good on time. We'll have about a 15-minute discussion, come back together for a breakout room or share outs, and then just close this out at the top of the hour. So I think we're still good for just a 15-minute conversation. I'm going to shift us a little bit because of the timing. I think it's going to be most important for us to share what you see here on the slide, just the questions around what does success look like in 1 year, 3 year, 5 years? What are the objectives that we should aim to accomplish together in this collaborative? And then how do we measure that we are successful? So let's go ahead and take out step 1, because again, we can do this offline and get input from you all once we send that content out for input and feedback. And so if that sounds okay, and I'm looking at Vince as well, let's focus the bulk of our conversations on step 2. Okay, great. We'll see you all in 15 minutes. Thank you.
Oh, we came back before they did.
Last time they beat us, so we were ready.
Hey, but now we're ready, right? And we were able to get everyone to provide some feedback on those 3 bullet points. So really appreciate your help. We're still trying to understand the different meetings and collaboratives that are in place. So, we just ask for your patience, right? And a little bit more time to kind of understand where are you plugging in and how we can best use this space for collaboration and peer-to-peer kind of conversation. And so far, the feedback that we have received in between has been really helpful. Thank you, Doreen. You unmuted. Go ahead.
No, I think it'd be good for us to reach out to Lassen Collaborative, get representatives from them on this group. And then the SISQ Collaborative, I know Shelley was a part of that. Again, I think there's energy to get that back. And, the ECM and CS is really going to be the hospital-based clinics, and the FQHCs is probably the largest providers. I'm not sure. But there's between this and workforce, there's some workforce regional stuff. I'm actually reaching out to Roger and Jonathan about that because I think there's opportunity if they're there. And then I think I sent the list to Melissa et al. Of the Highway 299 Collaborative, making overtures to them to get some representative on this and have each group report out. That's where you get the system and the regional kind of collaborative, I think, a little more in sync.
Yeah, I appreciate that, Doreen. Certainly those are next steps that we will be pursuing. And understanding the collaboratives, because some of them you and others have said you've been impacted by COVID, and how do we continue that energy?
Yeah, and maybe it would be good. We could strategize on that, but I could help you open those conversations probably to a deeper level and talk, just to talk about the importance of connecting into this, and others could too. But I think if you had folks from each that are participating in those collaboratives, this gives them strength and energy to go back to their collaboratives, and then you link all of those together. I think it's hard when you're, don't take this the wrong way. There's individuals that are, that are starting up on this, but they're not really connected. But a good thing, I've connected with Kara and Natalie, and I'm going to ask them to join the Shark Integrated Care Committee. So we're going to get them on that. So, that's a little more structure, I think, would help.
Okay. Thank you, Doreen. So I'm going to turn it back to Maiku. We have 3 minutes to go. I think you want to cover next steps for us.
Yes, that's correct. So let's go ahead and could we pull up that slide for next steps? There's actually one additional question that we had wanted to just pose to this group. So in addition to just ensuring that there's constant communication and ways for you all to get a hold of each other. And so, sorry, could we go back one more slide? Just to show the question for folks. Oh, sorry, 2 more slides. Okay. So yeah, so if you could all just paste in the chat, we want to know what medium you prefer for group communication, what kind of platform, that would work best for you all. And so if you could just drop that in the chat. And I'm sorry, there is a horn that is honking in the background. And so hopefully you all could still hear me clearly. But yeah, if you could drop that into the chat, we'd love to know how we can get this collaborative set up in a platform where you all can continue to communicate with each other, in between the sessions as well. And so with that, if we could go to the next slide, just on next steps for session 3. And so next month's session will focus on developing our measurement strategy and collaborative work plan. So just continuing to solidify that information. We'll have a post-event email as well that will include an assessment just to let us know and provide feedback on how this session went. A reminder for folks to register for every single session that we have, and we'll send that information ahead of time. Let's make sure we're networking with folks and that you had mentioned you want to offline with today, and we can help to connect you to those folks if you don't have their contact info at this time. We have a session recording and any slides and supplemental materials that will be shared via email. If you have any questions, we'll also want to share an FAQ doc. And if you have any other questions pertaining to the collaborative, please contact Eva, whose email is on the slide here. And lastly, supporting the recruitment of this collaborative. We really want to spread the word and make sure we're reaching other CalAIM stakeholders and partners who should be a part of this conversation and space. And so I did see Alexis, your hand is raised, so I want to go to you, but these are the next steps in between now and our session 3. Go ahead, Alexis.
Yeah, just 2 quick points, 30 seconds, because I know that we are at time. 3 quick points. Thank you all so incredibly much. These conversations were amazing. Number 2, if you did not have time to process what medium would work best for you to communicate offline with the entire group, please just email us, because I know that's something that has been uplifted multiple times, that we want to have, or you all want to have a medium to stay in touch. So please just email us, if you can't drop it in the chat. And number 3, just uplifting to Anita, that there was an update on the DHCS landing page. There was going to be some revisions made to the quarterly monitoring report that the plans have to submit. I know the providers submit them monthly to try to streamline that process and actually create like an automated process so that the encounter data that you are collecting is then transferred into an automated report. So I just want to let you know that relief is on the way, and that we're still going to chronicle this and figure out, just the best way to, advance that process as quickly as, we can as facilitators.
Yay, thank you.
Thanks, Alexis. Yes, and so if we could go to just our final slides here, just want to offer again a deep and special thank you to all of you. This just continues the conversations just get richer every single time, and so I'm looking forward to our future sessions together. Want to do a special shout out to our Health Begins team here with us, and Rishi, Sadnat, Alexis, Melissa, Shiva, and Eva. Thank you all so much. And then if we could go to the next slide, just want to offer my special thanks to our Everyday Impact Consulting team, Vince, Casey Ann, Elaine Able Mateo, who's a founding director with Everyday Impact Consulting. She's helping to provide support on this project as well in the background. So lastly, I want to close out with just some additional resources that are located at the back end of this slide. So if we can go to the next one, there will be some additional resources and key terms that you can take a look at. There's a lot of acronyms as well. So we have a key terms page here for folks to reference. But again, last but definitely not least, want to just share my special thanks to all the partners who made it here today. You really are helping us to shape the change that we want to see in our communities around implementation. And so just want to give a shout out to you all and appreciate you making time today. And with that, I will go ahead and